Hello, this is Dr. Kester here once again. I hope you're having a great day. Please join me in evaluating this second trimester obstetric ultrasound. As usual, I like to start evaluating from the cervix. The simple reason is that it enables us to evaluate the cervical length, the internal cervical os, to rule out placenta previa, vasa previa, and also to determine the presenting fetal parts, which in this case is the fetal head. So when we're looking at the fetal head, I like to examine the shape of the baby's head, then look at the transthalamic view here, the transcerebellar view, and the transventricular view. These are very important. This image shows us clearly the cavum, septum, pellucidum. It appears normal. Moving forward, we're going to look at an image. So far as we have been going on, can you tell what the fetal gender is? Now we move on in the examination of the fetal head to look at the sagittal view. The sagittal evaluation sometimes can be challenging, but it also enables you to look at the pons, the midbrain, and the medulla. The sagittal view of the fetal cerebellum is also seen, and then you evaluate the corpus callosum. The corpus agenesis can also be determined in an axial view at the transthalamic level. We'll talk more about this in the obstetric ultrasound course. But for now, know that these views of the fetal head are important in the second trimester ultrasound. Okay, so remember the questions posed. Where is the placenta? Where is the placenta location? Is this a baby boy or a baby girl? We need you to give the answers in the comment section. So we move on to examine the fetal heart. Here is a 4-chamber view of the baby. Okay, in examining the fetal heart, minimum requirement is that the 4-chamber view should be evaluated. Okay, and then there should be a normal offset of the tricuspid valve. If you can, you should also now be able to do a trimester view, the arc view, and all that. But in this patient, we are looking at the 4-chamber view. The fetal heart rate is also important because that may be the first pointer to an abnormality with the child. A color Doppler tells us, is there regurgitation? Is there any turbulence across the valves? Right now, we are looking at the sagittal view of the baby. We can see the spine. This is important. It's important to evaluate the spine to check for any spinal anomalies. So each of the vertebral bodies is evaluated. Each of the vertebral bodies is evaluated, and we look for defects in the spine. Okay, we can also evaluate and see, okay, that the diaphragm is intact, the fetal abdomen appears normal. These are important things to evaluate in the second trimester ultrasound. We also want to know where the cord insertion is. Okay, here we're looking at the axial view of the fetal abdomen at the level of the fetal stomach. This is important. This is the cord insertion. This is the cord insertion. We evaluate the cord insertion. Right. So remember the question asked earlier, where is the placenta location? What is the sex of the baby? Another question is, in your opinion, do you think this child has adequate amniotic fluid? Thanks for joining me so far. Please leave your comments in the comment section, and I want you to also like and subscribe if you found this useful. Have a nice day.